Question: describe the management of a patient with a suspected traumatic globe rupture. Answer: in a patient with a suspected traumatic globe rupture, eye injury, immediate eye protection and ophthalmologic consultation are vital to prevent further damage and infection. Surgical repair may be necessary to restore the integrity of the eye. Question: explain the concept of hemothorax evacuation in trauma patients. Answer: hemothorax evacuation involves draining accumulated blood from the pleural space in trauma patients with significant bleeding into the chest cavity. It restores lung expansion, improves respiratory function, and prevents complications like infection or fibrosis. Question: discuss the management of a patient with a suspected traumatic urethral injury. Answer: in a patient with suspected traumatic urethral injury, retrograde urethroplasty or cystoscopy is performed to assess the urethra. Surgical repair is required for severe injuries to prevent urinary leakage and stricture formation. Question: what is the significance of flail chest in trauma assessment? Answer: flail chest refers to a segment of the rib cage that moves paradoxically during respiration due to multiple rib fractures. It can lead to respiratory distress and compromised lung function. Management involves pain control, mechanical ventilation, and addressing associated injuries. Question: describe the management approach for a patient with suspected traumatic ophthalmic artery injury. Answer: in a patient with suspected traumatic ophthalmic artery injury, immediate ophthalmologic consultation is crucial to assess visual function and prevent vision loss. Angiography and embolization may be considered to control bleeding and preserve ocular perfusion. Question: explain the role of non-invasive positive pressure ventilation, NIPV, in trauma patients. Answer: non-invasive positive pressure ventilation, NIPV, is used in trauma patients with respiratory distress to improve oxygenation and ventilation without intubation. It can be beneficial in certain cases of chest trauma or respiratory failure. Question: discuss the management of a patient with a suspected traumatic adrenal injury. Answer: in a patient with a suspected traumatic adrenal injury, imaging studies such as CT scan are performed to assess the adrenal gland. Supportive care, hormone replacement therapy, and surgical exploration may be required if significant adrenal function is compromised. Question: what is the role of fibrinogen concentrate in trauma patients? Answer: fibrinogen concentrate is used in trauma patients with severe bleeding and coagulopathy to replenish fibrinogen levels and promote clot formation. It is particularly valuable in cases of hypofibrinogenemia or massive transfusion. Question: explain the concept of multiple organ dysfunction syndrome, MODS, in the context of trauma. Answer: multiple organ dysfunction syndrome, MODS, refers to the progressive failure of two or more organ systems following severe trauma. It results from a complex cascade of inflammatory responses and can lead to significant morbidity and mortality. Preventing and managing MODS involves early recognition, aggressive resuscitation, and addressing underlying causes. Question: discuss the management of a patient with a suspected traumatic cardiac tamponade. Answer: in a patient with a suspected traumatic cardiac tamponade, immediate hemodynamic stabilization and pericardiocentesis are crucial to relieve pressure on the heart. Surgical exploration and repair may be required for definitive treatment and prevention of recurrence. Question: describe the management approach for a patient with suspected traumatic popliteal artery injury. Answer: in a patient with suspected traumatic popliteal artery injury, immediate hemodynamic stabilization is vital. Surgical exploration and repair are required to control bleeding and restore vascular integrity. Temporary shunting may be used to maintain perfusion during surgery. Question: explain the role of hypertonic saline in traumatic brain injury management. Answer: hypertonic saline is used in traumatic brain injury management to reduce cerebral edema and intracranial pressure. Its osmotic effect draws fluid out of brain tissues, improving perfusion and reducing the risk of secondary brain injury. Question: discuss the management of a patient with suspected traumatic splenic injury. Answer: in a patient with suspected traumatic splenic injury, imaging studies such as CT scan are performed to assess the extent of injury. Non-operative management is often favored for stable patients with minor injuries, while surgical intervention may be required for significant bleeding or hemodynamic instability. Question: what is the purpose of using a nasogastric (NG) tube in trauma patients? Answer: a nasogastric (NG) tube is used in trauma patients to decompress the stomach and prevent aspiration in cases of bowel obstruction or ileus. It also aids in the assessment of gastrointestinal function and helps prevent nausea and vomiting. Question: describe the management of a patient with a suspected traumatic pancreatic injury. Answer: in a patient with suspected traumatic pancreatic injury, close monitoring of clinical symptoms, amylase levels, and imaging studies is crucial. Supportive care, pain management, and avoidance of oral intake are important for allowing the pancreas to heal and preventing complications. Question: explain the role of interventional radiology in trauma patients. Answer: interventional radiology plays a crucial role in trauma patients by offering minimally invasive procedures to diagnose and treat various injuries. Procedures include angiography, embolization, stent placement, and drainage of fluid collections, reducing the need for open surgery and promoting faster recovery. Question: discuss the management of a patient with a suspected traumatic cervical spine fracture. Answer: in a patient with a suspected traumatic cervical spine fracture, spinal immobilization is maintained until appropriate imaging studies, such as X-rays or CT scan, are performed. The neck is kept in a neutral position to prevent exacerbating potential spinal cord injuries. Question: what is the significance of seatbelt sign in trauma assessment? Answer: seatbelt sign refers to a bruise or abrasion across the abdomen or chest caused by a seatbelt during a motor vehicle collision. It indicates potential underlying internal injuries and prompts healthcare providers to perform thorough clinical evaluations and imaging studies. Question: describe the management approach for a patient with a suspected traumatic pelvic fracture. Answer: in a patient with a suspected traumatic pelvic fracture, hemodynamic stability is a priority. Pelvic stabilization techniques, such as pelvic binders or external fixators, may be employed to control bleeding and prevent further pelvic instability. Definitive management depends on the type and extent of fracture. Question: explain the concept of visceral heterotaxy and its implications in trauma patients. Answer: visceral heterotaxy is a congenital condition characterized by abnormal arrangement of internal organs. In trauma patients with visceral heterotaxy, anatomical anomalies may complicate diagnostic and surgical procedures. Careful evaluation and individualized management plans are necessary. Question: discuss the management of a patient with a suspected traumatic tracheal injury. Answer: in a patient with suspected traumatic tracheal injury, flexible bronchoscopy is performed to assess the airway and identify any injuries. Surgical repair is required for severe injuries that compromise airway integrity. Question: what is the purpose of using an epidural hematoma evacuation in traumatic brain injury? Answer: epidural hematoma evacuation involves surgical removal of accumulated blood between the skull and the dura mater in traumatic brain injury patients. This procedure relieves intracranial pressure, prevents herniation, and improves cerebral perfusion. Question: describe the management of a patient with a suspected traumatic spinal epidural hematoma. Answer: in a patient with a suspected traumatic spinal epidural hematoma, immediate neurosurgical consultation and imaging studies, such as MRI, are essential to confirm the diagnosis. Surgical decompression may be required to prevent spinal cord compression and neurological deficits. Question: explain the concept of inhalation injury in trauma patients. Answer: inhalation injury refers to damage to the respiratory tract caused by inhalation of noxious gases or particles, commonly seen in burn victims or trauma patients exposed to smoke or chemical fumes. It can lead to airway obstruction, pulmonary edema, and respiratory distress. Question: discuss the management of a patient with a suspected traumatic ureteral injury. Answer: in a patient with suspected traumatic ureteral injury, imaging studies such as CT urography are performed to assess the ureter. Surgical repair or stenting may be required for severe injuries to prevent urinary leakage and stricture formation. Question: what is the role of recombinant factor IX, RFX, in trauma patients? Answer: recombinant factor IX, RFX, is used in trauma patients with hemophilia B to replace deficient clotting factor and control bleeding. It helps promote clot formation and prevent excessive hemorrhage. Question: describe the management approach for a patient with suspected traumatic retroperitoneal hematoma. Answer: in a patient with suspected traumatic retroperitoneal hematoma, imaging studies such as CT scan are performed to assess the extent of bleeding. Non-operative management is often favored for stable patients with minor hematomas, while surgical intervention may be required for significant bleeding or hemodynamic instability. Question: explain the role of therapeutic hypothermia in traumatic brain injury. Answer: therapeutic hypothermia involves intentionally lowering a patient's body temperature to mitigate brain injury following traumatic brain injury. It reduces metabolic demands, suppresses inflammatory responses, and decreases intracranial pressure, potentially improving neurological outcomes. Question: discuss the management of a patient with a suspected traumatic spinal cord injury with neurological deficit. Answer: in a patient with a suspected traumatic spinal cord injury with neurological deficit, spinal immobilization is maintained, and urgent imaging studies, such as MRI, are performed to assess the extent of injury. Surgical decompression and stabilization may be considered to prevent further neurological damage. Question: explain the role of endovascular stent grafting in traumatic aortic injuries. Answer: endovascular stent grafting is a minimally invasive procedure used to treat traumatic aortic injuries. A stent graft is inserted through a catheter and positioned within the injured aorta to provide structural support and prevent further bleeding. Question: describe the management approach for a patient with suspected traumatic bronchopleural fistula. Answer: in a patient with suspected traumatic bronchopleural fistula, communication between the bronchus and pleural space. Management involves lung isolation, chest tube placement, and potentially surgical repair. Preventing air leakage and infection are important aspects of care. Question: describe the management approach for a patient with suspected traumatic posterior urethral injury. Answer: in a patient with suspected traumatic posterior urethral injury, retrograde urethrophy is performed to assess the urethra. Surgical repair or urethral stenting may be required for severe injuries that compromise urinary function. Question: discuss the management of a patient with a suspected traumatic aortic rupture. Answer: in a patient with suspected traumatic aortic rupture, immediate hemodynamic stabilization and vascular surgery consultation are crucial. Imaging studies, such as CT angiography, assess the extent of injury. Definitive surgical repair or endovascular intervention is required to prevent catastrophic hemorrhage. Question: explain the concept of vascular access complications in trauma patients. Answer: vascular access complications in trauma patients refer to issues arising from central or peripheral venous catheterization, such as infection, thrombosis, or pneumothorax. Proper insertion technique, maintenance, and vigilance are essential to prevent these complications. Question: describe the management approach for a patient with suspected traumatic retinal detachment. Answer: in a patient with suspected traumatic retinal detachment, immediate ophthalmologic consultation is essential to assess and manage the condition. Surgical intervention, such as retinal reattachment surgery, may be required to prevent permanent vision loss. Question: discuss the management of a patient with a suspected traumatic pancreatic pseudocyst. Answer: in a patient with suspected traumatic pancreatic pseudocyst, close monitoring of clinical symptoms, imaging studies, and drainage procedures may be required to manage the pseudocyst and prevent complications. Question: explain the concept of syndrome of inappropriate antidiuretic hormone secretion, SIAD, in trauma patients. Answer: SIAD is a condition in which the body produces too much antidiuretic hormone, ADH, leading to water retention, hyponatremia, and potential neurological complications. In trauma patients, it can result from head injuries or stress. Management involves addressing the underlying cause and correcting electrolyte imbalances. Question: describe the management approach for a patient with suspected traumatic bladder contusion. Answer: in a patient with suspected traumatic bladder contusion, supportive care, pain management, and monitoring are essential. Most bladder contusions resolve with time and conservative measures. Question: discuss the management of a patient with a suspected traumatic facial fracture. Answer: in a patient with a suspected traumatic facial fracture, imaging studies such as CT scan are performed to assess the extent of injury. Depending on the severity and specific fractures, surgical intervention may be required for repair and cosmetic restoration. Question: explain the concept of crush injury syndrome in trauma patients. Answer: crush injury syndrome occurs when a body part is subjected to prolonged compression, leading to muscle tissue damage and release of myoglobin into the bloodstream. It can result in kidney injury and metabolic disturbances. Aggressive hydration, monitoring, and addressing complications are crucial in management. Question: describe the management approach for a patient with suspected traumatic brachial plexus injury. Answer: in a patient with suspected traumatic brachial plexus injury, clinical assessment, electromyography, and imaging studies are used to determine the extent of nerve damage. Supportive care, physical therapy, and potentially surgical intervention are essential for functional recovery. Question: discuss the management of a patient with a suspected traumatic mandibular fracture. Answer: in a patient with a suspected traumatic mandibular fracture, imaging studies such as CT scan are performed to assess the extent of injury. Surgical repair may be required for complex fractures to ensure proper alignment and function. Question: explain the concept of blunt cardiac injury in trauma patients. Answer: blunt cardiac injury refers to damage to the heart resulting from non-penetrating trauma, such as motor vehicle collisions. It can cause arrhythmias, myocardial contusion, and valvular injuries. Monitoring, echocardiography, and appropriate interventions are crucial in managing blunt cardiac injury. Question: discuss the role of multidisciplinary collaboration in managing abdominal trauma. Answer: multidisciplinary collaboration is essential in managing abdominal trauma due to the complexity of injuries. Surgeons, trauma teams, interventional radiologists, intensivists, anesthesiologists, and other specialists work together to provide comprehensive care, decision-making, and optimal outcomes for the patient. Question: explain the management of a patient with a suspected abdominal aortic injury. Answer: management of a patient with a suspected abdominal aortic injury involves: stabilize the patient's condition, obtain imaging studies, for example, CT angiography, to diagnose and assess the extent of the aortic injury. Surgical intervention is necessary for aortic injuries, especially in cases of rupture, pseudoaneurysm, or dissection. Repair, grafting, or endovascular techniques based on the type and location of the aortic injury. Close monitoring of hemodynamics, perfusion, and complications. Question: describe the management approach for a patient with a suspected abdominal trauma during pregnancy. Answer: management of abdominal trauma during pregnancy involves: stabilize the patient's condition and prioritize maternal and fetal well-being. Obtain imaging studies, for example, ultrasound, CT scan, to assess injuries and evaluate fetal status. Multidisciplinary approach involving obstetricians, trauma teams, and neonatologists. Surgical intervention, if needed, while considering the safety of the mother and fetus. Close monitoring of maternal and fetal condition, specialized obstetric care, and neonatal support. Question: discuss the use of computed tomography, CT, in evaluating abdominal trauma. Answer: computed tomography, CT, is a valuable tool for evaluating abdominal trauma due to its ability to provide detailed cross-sectional images of the abdomen and pelvis. It aids in diagnosing solid organ injuries, vascular injuries, hollow viscous injuries, and associated complications. CT scans. Question: explain the management of a patient with a suspected abdominal trauma following a motor vehicle accident. Answer: management of a patient with suspected abdominal trauma following a motor vehicle accident involves: stabilize the patient's condition, perform a thorough primary and secondary survey to identify injuries and prioritize treatment, obtain imaging studies, for example, CT scan, X-rays, to assess injuries to organs, bones, and blood vessels. Surgical intervention for significant injuries, active bleeding, or hemodynamic instability. Multidisciplinary care, including trauma teams, surgeons, radiologists, and other specialists. Postoperative care, complications management, and rehabilitation. Question: explain the management of a patient with a suspected abdominal gunshot wound. Answer: management of a patient with a suspected abdominal gunshot wound involves: stabilize the patient's condition, obtain imaging studies, for example, X-rays, CT scan, to assess the trajectory of the bullet and potential injuries. Surgical exploration is often necessary to evaluate and repair injured organs, blood vessels, and tissues. Control bleeding, repair injuries, and provide drainage as needed. Postoperative care, monitoring for complications, and multidisciplinary management. Question: describe the principles of managing solid organ injuries in abdominal trauma. Answer: principles of managing solid organ injuries include: stabilize the patient's condition, obtain imaging studies, for example, CT scan, ultrasound, to assess the extent of the injury, associated injuries, and hemodynamic status. Non-operative management may be suitable for stable injuries, involving close monitoring, bed rest, and blood transfusion as needed. Surgical intervention is required for severe injuries, ongoing bleeding, or hemodynamic instability. Repair, resection, or organ-preserving techniques based on the extent of injury. Postoperative care, monitoring for complications, and follow-up imaging are crucial. Question: discuss the management of a patient with a suspected abdominal stab wound. Answer: management of a patient with a suspected abdominal stab wound involves: stabilize the patient's condition, Obtain imaging studies, for example, X-rays, CT scan, to assess potential injuries and trajectory of the stab wound. Surgical exploration may be necessary to evaluate injuries, repair damaged structures, and control bleeding. Close observation, wound care, and multidisciplinary management are important. Monitoring for complications, infection prevention, and follow-up care. Question: explain the role of interventional radiology in abdominal trauma management. Answer: interventional radiology plays a role in managing abdominal trauma by offering minimally invasive techniques to control bleeding, embolize vascular injuries, and perform drainage procedures. It can be particularly useful in stable patients with certain injuries where open surgery might pose greater risks. Question: describe the principles of managing vascular injuries in abdominal trauma. Answer: principles of managing vascular injuries include: stabilize the patient's condition. Obtain imaging studies, for example, CT angiography, conventional angiography, to diagnose and locate the vascular injury. Surgical intervention is often required for arterial injuries, significant venous injuries, or active bleeding. Repair, resection, bypass, or ligation based on the type and location of the vascular injury. Postoperative monitoring of perfusion, complications, and follow-up care. Question: describe the principles of managing diaphragmatic injuries in abdominal trauma. Answer: principles of managing diaphragmatic injuries include: stabilize the patient's condition. Obtain imaging studies, for example, CT scan, chest X-ray, to diagnose diaphragmatic injury and associated injuries. Surgical exploration is often required for significant diaphragmatic injuries, especially if herniation or visceral injury is present. Repair of the diaphragm and reduction of herniated organs. Postoperative care, respiratory support, and monitoring for complications. Question: discuss the management of a patient with a suspected omental injury. Answer: management of a suspected omental injury involves: stabilize the patient's condition. Obtain imaging studies, for example, CT scan, to diagnose and assess the extent of the injury. Conservative management may be suitable for minor omental injuries without complications. Surgical exploration and repair are necessary for significant injuries, herniation, or complications such as strangulation. Postoperative care, infection prevention, and follow-up care are important. Question: explain the concept of traumatic hernia in abdominal trauma. Answer: traumatic hernia refers to a hernia that develops at the site of a previous abdominal injury, often due to a weakening or disruption of the abdominal wall musculature. It can occur after blunt or penetrating trauma and may require surgical repair to prevent complications such as incarceration or strangulation. Question: describe the management approach for a patient with a suspected retroperitoneal abscess. Answer: management of a suspected retroperitoneal abscess involves: stabilize the patient's condition. Obtain imaging studies, for example, CT scan, to diagnose and assess the extent of the abscess. Drainage of the abscess is necessary, often performed using percutaneous techniques guided by imaging. Broad-spectrum antibiotics, supportive care, and monitoring for complications are essential. Follow-up imaging and clinical assessment to ensure resolution of the abscess. Question: discuss the role of laparoscopy in the management of abdominal trauma. Answer: laparoscopy can play a role in the management of abdominal trauma by offering minimally invasive exploration and intervention. It can be used for diagnostic purposes, evaluation of injuries, and selected procedures such as organ repair or drainage of hematomas. Question: discuss the management of a patient with a suspected mesenteric injury. Answer: management of a suspected mesenteric injury involves: stabilize the patient's condition. Obtain imaging studies, for example, CT angiography, to diagnose and assess the extent of the injury. Surgical exploration and repair are often required for mesenteric injuries, especially in cases of active hemorrhage or peritonitis. Revascularization, resection, or ligation of the affected vessels based on the severity of the injury. Close monitoring of perfusion, complications, and follow-up care. Question: explain the concept of bowel injury scale in abdominal trauma assessment. Answer: the bowel injury scale is used to classify the severity of injuries to the small and large intestines in abdominal trauma. The scale ranges from I, superficial injury, to 4, full thickness injury with involvement of the mesentery. Question: describe the management approach for a patient with a suspected rectal injury. Answer: management of a suspected rectal injury involves: Stabilize the patient's condition. Obtain imaging studies, for example, CT scan, proctosigmoidoscopy, to diagnose and assess the extent of the injury. Surgical intervention is often necessary for rectal injuries, especially in cases of full-thickness perforations or significant contamination. Repair, resection, or colostomy may be required based on the location and severity of the injury. Postoperative care, infection prevention, and management of complications are crucial. Question: discuss the role of diagnostic imaging modalities, for example, CT scan, ultrasound, in evaluating abdominal trauma. Answer: diagnostic imaging modalities play a crucial role in evaluating abdominal trauma by providing detailed information about injuries, organ involvement, and associated complications. CT scan is widely used to assess solid organ injuries, vascular injuries, and bone fractures. Ultrasound, especially fast, focused assessment with sonography in trauma, is valuable for detecting fluid collections, intra-abdominal bleeding, and free fluid. Question: explain the management of a patient with a suspected abdominal wall hematoma. Answer: management of a suspected abdominal wall hematoma involves stabilize the patient's condition. Obtain imaging studies, for example, ultrasound, CT scan, to diagnose and assess the extent of the hematoma. Conservative management includes observation, pain management, and monitoring for expansion or complications. Surgical evacuation or drainage may be necessary for enlarging or symptomatic hematomas. Postoperative care, infection prevention, and follow-up care are important. Question: explain the concept of secondary abdominal compartment syndrome. Answer: secondary abdominal compartment syndrome occurs when intra-abdominal pressure increases due to factors like fluid resuscitation, inflammation, and edema. It can lead to decreased perfusion of abdominal organs and contribute to multiple organ dysfunction. Question: describe the management approach for a patient with a suspected colon injury. Answer: management of a suspected colon injury involves stabilize the patient's condition. Obtain imaging studies, for example, CT scan, colonoscopy, to diagnose and assess the extent of the injury. Surgical intervention is required for perforations, significant injuries, or ongoing bleeding. Repair, resection, or colostomy may be necessary based on the severity of the injury. Postoperative care, infection prevention, and management of complications are crucial. Question: discuss the use of negative pressure wound therapy, NPWT, in abdominal trauma management. Answer: negative pressure wound therapy, NPWT, involves applying negative pressure to a wound through a vacuum-assisted dressing. It can be used in abdominal trauma to promote wound healing, reduce infection risk, and manage open abdominal wounds. Question: explain the management of a patient with a suspected vascular injury in abdominal trauma. Answer: management of a suspected vascular injury involves stabilize the patient's condition. Obtain imaging studies, for example, CT angiography, conventional angiography, to diagnose and locate the vascular injury. Surgical intervention is required for significant arterial injuries, active hemorrhage, or hemodynamic instability. Repair, ligation, or vascular reconstruction may be needed based on the type and location of the injury. Close monitoring and follow-up care for vascular complications are essential. Question: describe the principles of managing hollow viscous injuries in abdominal trauma. Answer: principles of managing hollow viscous injuries include stabilize the patient's condition. Obtain imaging studies, for example, CT scan, gastrographin study, to diagnose and locate the injury. Surgical intervention is necessary for full-thickness perforations, intra-abdominal contamination, or ongoing sepsis. Repair, resection, or drainage of abscesses based on the extent of the injury. Postoperative care, infection prevention, and nutritional support are important. Question: describe the steps in the management of a patient with a suspected duodenal injury. Answer: management of a suspected duodenal injury includes stabilize the patient's condition. Obtain imaging studies, for example, CT scan, to diagnose the injury and assess associated injuries. Surgical exploration is necessary for penetrating injuries, peritonitis, or signs of leakage on imaging. Repair of the duodenum and drainage of abscesses if needed. Postoperative care and monitoring for complications are crucial. Question: discuss the role of angiography in the management of abdominal trauma. Answer: angiography is used in the management of abdominal trauma to identify and treat vascular injuries. It can assist in embolization of bleeding vessels, especially in cases of arterial injuries or active hemorrhage. Question: explain the management of a patient with a suspected renal injury. Answer: management of a suspected renal injury involves: stabilize the patient's condition, obtain imaging studies, for example, CT scan, to diagnose and assess the extent of the injury. Non-operative management is suitable for stable injuries without ongoing bleeding or urinary extravasation. Surgical exploration or repair is required for severe injuries, urinary extravasation, or hemodynamic instability. Postoperative care, monitoring for complications, and management of renal function are important. Question: describe the principles of trauma laparotomy in abdominal injuries. Answer: trauma laparotomy is a surgical procedure used to explore and repair abdominal injuries. Principles include: thorough exploration of all abdominal organs, control of bleeding and hemostasis, repair of injuries to hollow viscera and solid organs, removal of damaged tissue or necrotic bowel segments, closure of abdominal layers with consideration for wound contamination, postoperative monitoring and management of complications. Question: discuss the use of damage control laparotomy in severely injured patients. Answer: damage control laparotomy is a staged surgical approach used in severely injured patients with multiple injuries. It involves controlling hemorrhage and contamination, temporarily closing the abdomen, and addressing other life-threatening injuries. The abdomen is reopened later for definitive repair once the patient is stabilized. Question: discuss the management of a patient with a suspected bladder injury. Answer: management of a suspected bladder injury involves: stabilize the patient's condition, obtain imaging studies, for example, CT scan, cystogram, to diagnose the bladder injury. Non-operative management with urinary catheterization and drainage may be appropriate for minor injuries. Surgical repair or exploration is required for significant injuries or extravasation of contrast on imaging. Question: explain the concept of the hollow viscous injury scale in assessing abdominal injuries. Answer: the hollow viscous injury scale is used to classify the severity of injuries to hollow organs in the abdomen, including the stomach, small intestine, colon, and bladder. The scale ranges from I, minor contusion or laceration, to 4, full thickness perforation. Question: describe the management approach for a patient with a suspected adrenal gland injury. Answer: management of a suspected adrenal gland injury involves: stabilize the patient's condition, obtain imaging studies, for example, CT scan, to diagnose adrenal injury. Conservative management with observation and supportive care is often suitable for minor injuries. Surgical intervention may be needed for severe injuries, ongoing bleeding, or hemodynamic instability. Postoperative monitoring and adrenal hormone replacement if necessary. Question: discuss the complications that can arise from abdominal trauma. Answer: complications of abdominal trauma can include hemorrhage, internal bleeding leading to shock, peritonitis, infection of the peritoneal cavity due to perforation, abscess formation, localized collection of pus, bowel obstruction, blockage of the intestines, organ dysfunction, liver, kidney, or pancreatic dysfunction, adhesion formation, abnormal tissue connections, herniation, protrusion of tissue through weakened areas, sepsis, systemic infection and inflammation.